Good afternoon, everyone. Thank you so much for joining today's Using PSYCKES for CCBHC's training webinar hosted by the Office of Population Health and Evaluation. Before we get started with today's training, let's go over some housekeeping details. For today's webinar, all phone lines are muted. If you have questions at any point during the webinar, please utilize the chat feature located at the bottom right of the screen. When you submit a question, it will be submitted to everyone, as that is the default setting of the chat box. We would also like to let you know that today's slides and recording link will be emailed to all attendees. They will also be posted on our PSYCKES public website shortly after the webinar. All right, so now that the housekeeping details are out of the way, let me quickly provide you all with our agenda for today's webinar. We will start the training with PSYCKES overview. Now, this may be a review for some of you, but we will talk about what PSYCKES is, who is included in the application, and what types of data is available. We will then provide details on accessing client-level data within our PSYCKES application. We will also go over our recipient search features, and this is where we have our population health cohort filters. For example, you can utilize this feature to apply specific CCBHC filters that might be of interest in regards to the work that you do. We will also take a look at the client level details within the clinical summary, and we will move on to quality improvements with my QR reports. We will then take a look at our quality indicators we have in our application that might be useful for you. As you may have noticed, all of these topics focus on different features within the application. So we also wanted to dedicate some time on how you or additional staff members from your agency can gain access to the PSYCKES application. We will then end the training webinar by providing you additional information regarding our PSYCKES resources, as well as provide you contact information of our PSYCKES help desk. We will also leave time at the end to answer a few questions on air. All right, so without any further ado, let's begin today's webinar with PSYCKES overview. So what is PSYCKES? PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System. This is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data, as well as data from other state administrative databases. Our PSYCKES application is designed to support data-driven clinical decision-making, care coordination, and quality improvement. Please note that in PSYCKES, we have ongoing data updates. So the data in the quality indicator reports are updated on a monthly basis, whereas the client-level clinical summary is updated on a weekly basis. So now who is viewable in PSYCKES? We do currently have over 13 million individuals viewable in PSYCKES. It includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. So if a recipient falls within this population, we will provide all data. Some examples of the data that you will find in PSYCKES include details regarding clients' general medical health information, behavioral health details, residential information, lab and pathology details, as well as many other types which we will cover in this webinar shortly. So in our introductory slides, I mentioned that PSYCKES includes data from many administrative databases. So let's take a look at what data is available in PSYCKES. As mentioned previously, we have a few different data sources feeding into the application. So firstly, our clinical summary provides 5 years and beyond worth of data, and again, it's updated weekly. Our biggest billing data source that we have is Medicaid billing. So all Medicaid fee-for-service claims and managed care encounter data is coming into our application across treatment settings. Now, I do want to mention that with Medicaid billing data source, there is a bit of a lag from the time the service occurs to the time it shows up in the application. For example, something like medications, we consider those a little bit quicker with a quicker turnaround time from the time the medication is picked up to the time it shows up in PSYCKES, and it could be as short as 2 weeks. But things like outpatient and inpatient services, it can take a couple of months from the time the service occurred to when it shows in our application. And that's why we have our other data sources, and that would be our state administrative databases as listed on the screen. These are more real time with a 0 to 7 day lag. So let me mention a few here. So we have the New York City Correctional Health Services. So if somebody spends some time in jail-based care setting, we will have that data in our application. We also have Department of Homeless Service data from New York City, and this gives you the shelter name, the program type, the placement date and exit date, along with exit reason, as well as the shelter director contact information. Then we have health home enrollment and CMA provider information coming from DOH map. So we have the name and the contact information for the health home as well in our application. If somebody spends some time in this state psychiatric center, we have the state psychiatric center electronic medical record, so the EMR data feeding into PSYCKES. We have assisted outpatient treatment provider contact, ACT information, residential and adult housing program information coming in from CARES. And we also have suicide attempt related information. And for that one, we have it coming from NIMERS. And in this instance, all data is available. So even if a suicide attempt occurred 15 or 20 years ago, that would still show in our application. And then we also have safety plans, screenings, and assessments that can be entered in you as the provider into the application through PSYCKES My Choice. And then lastly, we have intensive mobile treatment, AOT referral under investigation, and mobile crisis team data information coming from DOH MH Maven. So in the past few slides, I mentioned quality indicators several times. So what exactly are quality indicators, also known as quality flags? So OMH has identified a number of health conditions or treatment issues that are quite important. And what PSYCKES does is that it tracks clients who are positive for one or more of these health conditions or treatment issues. This way, the provider, the managed care plan, local county or state government leadership, they can be made aware and take necessary steps. And these flags can assist with supporting clinical reviews as well as quality improvement. Another thing I want to mention in regards to these quality indicators is that we also provide the information as aggregate data, which allows you to view the prevalence rate, again, at the program level, at the agency level, managed care plan by region or state. So you can peek at these prevalence rates and compare them to identify opportunities for improvement. We then have our performance tracking indicators, and this comes from the New York State Department of Health. So these indicator sets include many of the substance use disorder quality measures. While the PSYCKES quality improvement report is updated on a monthly basis, DOH calculates these performance tracking indicator sets after a 6-month billing data maturation period to allow for service invoicing. So when you navigate to the MyQI Reports tab in PSYCKES, the as of date reflects the most recent performance tracking data run by DOH. And these measures are based on a 12-month period of services. So on the screen, here are some examples of quality indicators that might be useful and relevant to the work that you do as a CCBHC. So we have our behavioral health QARR improvement measure set, which includes flags such as the discontinuation of an antidepressant measure. This looks at adults who were diagnosed with major depression who started on an antidepressant but didn't remain on it for a minimum of 12 weeks. Another example that we have here is no diabetes screening for adults diagnosed with schizophrenia or bipolar disorder who are on an antipsychotic. Then just coming down below, we have general medical health, which captures individuals who didn't have an outpatient medical visit in the past year. Again, going down the table, we have our admission post-discharge from any hospital measures, and this looks at clients who may be cycling in and out of hospitals. And the key thing to note here is that these readmission measures are episode-based, meaning they are counting the number of discharges rather than the number of individuals meeting the criteria. Then we have our mental health performance tracking measure set, and there's a number of measures included within the set that might be helpful for the work that you do, such as no follow-up after mental health inpatient or mental health emergency department visit within 7 or 30 days. And lastly, we have our SUD performance tracking measures. And here you can view clients meeting criteria for SUD related measures, such as no initiation of OUD treatment or MAT. And just to note here, these measures won't be visible unless you have a client sign consent or with clinical emergency access. And we will be going over those criteria in much more detail shortly. Again, in the PSYCKES introductory slide, I mentioned wide variety of data that feeds into PSYCKES application. So all of this data is available in the application in different types of report. Firstly, we have the individual client level report, and this is the clinical summary. This is the Medicaid and the state administrative databases treatment history and provides up to 5 years worth of data and beyond for some data elements. We then have our provider level reports, and there are 4 different types of this report. First, we have MyQI reports, which you heard me mention in the previous slide. Here you can review the names of clients who are flagged for a health condition or treatment issue. If you are a provider level user, you would enable access to get information for that specific recipient. And you can also apply specific CCBHC quality flag filters. Similarly, for recipient search, you can run ad hoc reports to identify cohorts of interest. You can also look at a list of recipients in different advanced views that will provide additional information columns. If you have provider level access, this is where you can enable access to view a client's clinical summary. Moving down to our usage reports, this is used to monitor PHI access by staff. So when you go to usage tab in PSYCKES, you can see which team member from your facility has viewed a client's clinical summary or has enabled access. Next, we have the utilization reports, and this is to support providers that have value-based payment data needs. And lastly, we have our statewide reports. So this is quite similar to our MyQI report. And through statewide report, you can look up a quality indicator and review statewide proportions by provider location or client location. And you can further narrow it down to client or provider's county or region. You can also pull proportions based on network and provider. And to mention again, these are at the aggregate level. So now let's talk about ways in which you can enable access to client level data in PSYCKES. So the first thing I want to mention here is how a client is linked to your agency. Well, there are 2 ways. If a client has a billed service at your agency within the past 9 months, or if a client is enrolled in your agency's health home or care management program according to DOH MAP, then a client is automatically linked to your agency. The other way is through manual linkage. So that means you as a PSYCKES user at the provider level can go into the application and attest to one of the following. If you can attest that the client signed a PSYCKES consent form, a DOH Health Patient Information Sharing consent form, or a BHCC consent form, you will indicate that when enabling access and the client will be linked to your agency. Similarly, you could also attest that you have obtained verbal consent or there is a clinical emergency or the client's currently being served by or transferred to your agency. Again, these would manually link the client to your agency. Okay, so sort of continuing from the previous slide, let's take a look at how different level of access that will allow you to view client level data in PSYCKES in a bit more detail. So the first category that we have here is signed consent. So this incorporates PSYCKES consent form, the BHCC consent form, as well as the DOH Health Home consent form. And if a client has signed these consent form, it allows you access to all available data, and it includes data with special protection such as SUD, HIV, family planning information, genetic testing, and it allows you access to data for 3 years after the last billed service. So if you keep billing the client, that 3 years keeps rolling based on the last billed service. And a quick note here, if your agency is part of a network, BHC consents are especially beneficial to obtain since they grant access to both you as a provider and the network, and it allows access to the client's full summary as long as a data sharing agreement is in place between the organization and the network. Another level that we have is verbal consent, and this allows access to limited data for 9 months. So it excludes data with special protection. So in the previous couple of slides, when I was mentioning SUD quality indicators, if a client has provided verbal consent, you will not be able to view those SUD-related quality indicators. So with verbal consent, you will be able to drill into a client's clinical summary, but any data with special protection is going to be excluded. And again, with verbal consent, you'll have access to a client's data for 9 months. Now, coming down to our clinical emergency. So, if a provider attests to a clinical emergency, it allows access to all available data, including data with special protection for 72 hours. And in the next slide, we'll sort of go over some criteria and protocols related to clinical emergency. But for now, we'd like to mention that you will be given access to all available data, but for 72 hours. And lastly, we have attestation of service. So this applies to client currently being served by or transferred to your agency. Now, what this does is that it will link client to your agency for any recipient search reports, but it will not allow you to drill into the client's clinical summary. So they'll appear in your cohort reports, but it will not allow you to actually take a look at the detailed clinical summary. So, like mentioned previously, so here are some criteria and protocols related for a clinical emergency. So, if a client refuses or is unable to consent and is having a clinical emergency, the provider is permitted to obtain a PSYCKES clinical summary without consent. And we often refer to this as breaking the glass scenario. And just to include it here as well, so the New York State Public Health Law defines clinical emergency as a medical or behavioral condition for which there is an immediate need for treatment and the symptoms are sufficient severity that the absence of immediate treatment would likely result in serious harm to self or others. And towards the bottom, we have a few examples of situations where breaking the glass scenario applies. So some of the examples are threat of or attempt at suicide or serious bodily harm or other conduct demonstrating danger to themselves. Another example is homicidal or other violent behavior by which others are placed in reasonable fear of serious physical harm, inability or refusal due to mental illness to provide for their own essential needs such as food, clothing, necessary medical care, personal safety, or shelter. Another situation could be overdose, sedation, altered mental status, catatonia, or otherwise non-responsive. If you have any questions about what would be considered as a clinical emergency, or if you have any questions about the consent process, please do not hesitate to reach out to our PSYCKES help desk. An important note here is that providers are responsible for ensuring that medical record supports emergency access by documenting why and how the client meets criteria for a clinical emergency and attesting with their signature, date, and timestamp. So here we have a visual chart of the different types of consent levels, as well as what type of data is available and for how long. I'm not going to go over all of these as we previously went over it in detail, but if you'd like a visual pattern, or if you'd like a visual look at the different access level, please feel free to refer to this chart as well. So now that you know what PSYCKES is, what types of reports are available, and what is needed to view the client level data, let me show you how you would enable access through Recipient Search. So once you are logged into PSYCKES, once you go to Recipient Search, Individual Search tab, step one would be to enter recipient identifiers and click Individual Search. Now, the unique recipient identifiers include Medicaid ID and Social Security number. Now, if you do not have that information available, we also have a place where you can enter the client's last name, and you can also enter either their date of birth or their first name. And if you'd like to apply additional filters, we also have these characteristics filters where you can apply age, gender, race, ethnicity, client region, and client county filters to narrow down your search result. So let me show you how that actually looks like in the application. So here, when you toggle over to Recipient Search tab, you'll see two different tabs available. So you have the Individual Search and Cohort Search. So you can select Individual Search, and here you can enter the recipient identifier. So you can enter a client's Medicaid ID or Social Security number. And if you do not have this information available, you can also enter the client's first name, last name, and date of birth. And again, we have our characteristics filters. So if you'd like to narrow down the results, you can also apply these filters as well. And once you have the information added in this page, you can select individual search. So that is going to be our step one. So once you select individual search, it will take you to this next screen that says one recipient found. And as you can see here, it will show you a nice column, nice table that includes the client's name, gender, age, and date of birth, the unique identifiers, the race and ethnicity, address, Medicaid managed care plan, Medicaid quality flags, the planning considerations column, and then you'll also see this current PHI access column. And right now, because there is no access enabled, you will see this enable access blue hyperlink. So here you can select enable access. Now, if you're not finding any match, you can always go back to the individual search page using this modify search, and you can apply additional filters to narrow down your result or also to double check the information. So what happens once you click this enable access link? It will take you to this next screen where it will ask you to attest to the following. So if a client has signed a consent form, you can select these options here. And if you select either of these three options, again, it will allow you access to all available data for 3 years. Whereas if you select verbal consent, it will allow you access just for 9 months. If it's a clinical emergency, again, all available data for 72 hours. So you can select any that applies. In this example, we have selected client signed a PSYCKES consent. So once you have that checkbox clicked off, you can select this next option. Once you select next, it will take you to this confirmation screen. So the first thing that we ask that you do is confirm that it is the current client before enabling consent. So please make sure to verify that unique identifiers, the date of birth, as well as address. And then the second section that we have is this, how do you know this is the correct person? So the first option that we have available is you as a provider attesting to client's identity. If a client has provided a photo ID or 2 forms of non-photo ID, you would come down to the second option and select that. And if a client has provided 1 photo ID, you can go to identification 1 and the drop-down option will be available to select that specific ID. So once you have a major selection, you will see these 2 blue buttons. So the first one is enable. So when you select this option, it will take you back to the table that we previously saw, but instead it will show PSYCKES consent under current PHI access column. But if you'd like to enable consent and view the clinical summary at the same time, you can select the second option, and this will directly take you to the client's clinical summary. So in this example, we are actually going to select this enable option. So let's see what that looks like. So as you can see, we have enabled consent. So now the client's name appear in a blue hyperlink, and you can select it to drill into the client's clinical summary. Another big difference that you may have noticed is this current PHI access column. So here it shows PSYCKES consent, and you also have the option to update access. So this is how you will enable access and view a client's clinical summary through the recipient search, individual search. So now that we are on the topic of recipient search, let's take a look at population health with recipient search. So here you can apply many different filters that will allow you to pull up a list of clients that meet the criteria for those filters. So taking a look at recipient search, so the clients are linked to a provider agency if billed for in the past year or currently linked through MAP. And for recipient search, you can search for an individual client or generate a list of clients meeting specific criteria. And here are some examples. So if you'd like to pull up a list of clients who have complex needs, you can apply that filter. You can also apply alerts filter, homelessness, any social determinants of health filter, services utilized for your agency or other agencies in New York State. So for example, if you'd like to take a look at a list of clients from your agency who have utilize CCBHC services from another agency in New York State, you will be able to do that through recipient search as well. And you can also apply high utilization filters, and these are for individuals who are high utilizers of those inpatient and ED hospital services. And the good thing about recipient search is that whenever you pull up a list of recipients, you do have the option to export that file in an Excel format or a PDF format. And then we also have our advanced view. So we have care coordination advanced view, high risk, high need, high risk, advanced view, hospital utilization. We also have complex needs, advanced views, as well as outpatient providers related advanced views. So what this does is that along with the general information that we saw in the previous slides, it will also have these additional columns that will provide you information that may be relevant to the work that you do. So let's take a look at our cohort search options available. So when you log into PSYCKES, now instead of selecting individual search, you can select cohort search. And right now, I wanted to mention this limit number of results, and this is by default set to 50. So whenever you apply these filters and select search, it will by default show you 50 recipients, but you can always expand this list using this drop down. So as you can see, you can again apply the characteristics filters, but we also have these different filter buckets. So we have the populations and planning consideration, and that's where a lot of our complex needs and alert filters are located. And we also have the social determinants of health filter as well. And you can scroll down and you will also be able to find many other filters, which we will cover shortly. So let's take a look at our alerts filter located within the populations and planning considerations bucket. So here you can search for clients with a history of suicide attempts, suicidal ideation, or opioid overdose, as well as many other alert filters using this drop down. And in this instance, you can only select one filter at a time, and it will be able to pull up that recipients list for you. Comparing that to our homelessness alerts, here you can search for homelessness alerts such as any shelter or outreach related information. And in this instance, you may have noticed that it looks slightly different. So this time we have this checkbox option. So here you can actually make multiple selections at a time. So you can select 4 of these categories at a time. So you can select a filter from the homelessness all source category. You can also select homelessness New York City DHS, any filters from this category, as well as the Medicaid source. So in this instance, you can select 4 at a time. Then coming down to our complex needs, this is similar to the homelessness alerts in the sense that you can select multiple criteria at a time since it's a checkbox option. So you can search for any complex needs, or if you'd like to kind of go into the specifics of it, you can also select any of these general eligibility criteria. And you can, again, select 4 at a time, which is a good feature to have. All right, so another section that I wanted to mention, and this is actually a new feature that we have added in PSYCKES, and that is our plans and documents filter. So if you go to our populations and planning considerations bucket, you'll see this plans and documents filter. So if a client has uploaded or if a provider has uploaded any of these plans and documents, you do have the option to kind of use this filter to pull up a client to pull up a list of clients who, let's say, has a safety plan uploaded in their clinical summary, or if a client, if you'd like to pull up a list of clients who do have the psychiatric advance directive document uploaded, you do have the option to directly apply that filter and complete the search. So this is a new feature that we have added. And we also added additional filters in our Medicaid enrollment status. So this is sort of in response to the new guidelines, new federal guidelines surrounding Medicaid coverage. So we have all these additional filters. And when you log into PSYCKES right now, you may not be able to see some of these because we are in the process of adding it to our application. So this is sort of like a sneak peek into what's to come at the end of July. But sort of taking an example, you have these Medicaid recertification filters where you can apply these filters. So for example, if you'd like to if you'd like to view a list of clients whose Medicaid coverage expires within the next 3 months, you have these options and filters that you can apply. So you can gather a list of clients who meet the eligibility. And it also kind of breaks it down into whether the client has to recertify through New York State of Health or if they have to renew via local Department of Social Services, so the LDSS. So we have that filter available. And if you also would like to take a look at a list of inactive Medicaid clients, so let's say a client has their Medicaid expired in the last 3 months, we do have filters for that. So these are some of the new filters that we have added, and we really hope that it is helpful for you in the work that you do. So just wanted to quickly mention that. So coming down to our social determinants of health filter. So in this filter, you have all these different categories available for you to select. And one thing that I wanted to mention is that we have these domains that have this gray box, and when you select this gray box, it will actually show you all these subcategories. So in this instance, we have problems related to housing and economic circumstances selected. So when I select this gray box right here, it's going to show me all these different subcategories. So in this example screenshot, we have financial insecurity, sheltered homelessness domains selected from this big category. And we also have additional ones selected. So if you'd like to filter based on social determinants of health, you can do so using this filter available in the cohort search. And then coming down to our quality flags. So here we have all of our quality flags listed, and you can actually select 4 quality flags at a time. So if you select control and click on any of these quality flags, you will be able to make multiple selections. So some of the quality flags that you may be interested in related to CCBHCs might be no follow-up after mental health inpatient, 30 days. So you can select all these quality flags and run that report as well. Because we have so many of these quality flags, if you are unsure about the definition of it, we do have a link for all of the definitions right here. So when you select this link, a pop-up window will show up where you can find definitions to all of our quality flags. And I would like to draw attention to this as of date. So as mentioned previously, our quality flags are updated on a monthly basis. And sort of going down to our cohort search page, you also have the ability to search and apply medication and diagnoses related filters. So here you can search for medication or diagnostic category, or you can also type in individual diagnoses or ICD-10 code, and it will pull up the recipients list for you. Now, taking a look at specific provider, so in the provider section, it is going to show you up it will show your agency, and here you can take a look at individuals receiving specific services from your agency. So for example, under the service setting, if you go to outpatient mental health section, it will have the CCBHC service setting available, so you can apply this filter right here and run a report, and it's going to give you a list of every single client from your agency that is receiving CCBHC services. On a similar note, we have the services by any provider. And in this section, you can search for individuals you have served who are receiving different types of services from other providers in New York State. So, for example, let's say that you would like a report on a list of individuals from your agency who is, let's say, receiving CCBHC services from other New York State providers. You do have an option to kind of take a look at that. So you can also come down to this outpatient mental health section and you can apply any of the filters that may be helpful for you. So that is another bucket that we have. And another thing that I wanted to mention now that we are in our services by any provider section is that you can also search for high utilizers by using the service utilization and number of visits section. So here, for example, if you would like to take a look at high utilizers for emergency room related services, especially for mental health diagnoses, you can select that option. And if you select this number of visits drop down, it will show you a bunch of different numbers. So if you'd like to take a look at a list of clients who have utilized this specific service 3 or more times, you can select that in this drop down and it will run that report for you. So that is another feature that we have available. So now let's say that you have applied all these different filters. So in this example, we are going to apply the CCBHC filter. So whenever I apply this filter, it's going to show me the number of recipients found at the top of the list. And it's going to give you the table that we previously saw. So we have the name, gender and age, Medicaid ID, date of birth, race and ethnicity, Medicaid managed care plan, Medicaid quality flags, planning consideration column. I do want to mention that for a planning consideration column, this is a really helpful column to have as it includes these different alerts and complex needs notifications that you can view without having to enable consent. So just taking a look at these two examples, in this instance, the client has PSYCKES consent and you are able to view the notification section. Coming down here, the client, you don't have the access enabled, but it will still show you these notifications. So it's a really important feature that we have recently added. Another thing that I wanted to point out is this view section. So this is where um, our advanced views are located. So right now, this is what we call our standard view, but here you can come in and change different views. So when you select this eye icon right here, it's actually going to show you what types of advanced views that we have available. So we have the standard view, the care coordination view, the complex needs, Health Home Plus, high fidelity wraparound advanced view, high need, high risk advanced view, hospital utilization, as well as outpatient providers. And comparing that to the columns displayed, as you can see, we have all these additional columns made available for you to take a look at if it applies for the search that you are completing. So that is another option. So let's say we applied one of these advanced views. So how is that going to look at like in our application? So in this instance, we have applied this complex needs advanced view. And as you can see, we have these general information located right here. But now you have all these additional columns. So for example, we have this complex needs column, Health Home Plus eligibility column, this high fidelity wraparound column, as well as current PHI access column. And you can further scroll into it and see these additional columns. So as you can see, we have this risk category. So here you'll find the AOT related information, suicide attempt related information, as well as opiate overdose related information. So it's a really great view to have, and you can also export this in an Excel format, so you can also export it and save it in your local file as well. So as we scroll further, you can also see this high ER/inpatient utilization or youth with residential treatment section columns applied. So again, you have all these additional columns that will display the information that might be helpful for you. So as you scroll, we also have these intensive outpatient related services. So we have residential treatment facility information, active enrolled or discharged in the past year, as well as IMT related information column. So let's keep scrolling all the way towards the end, and then we have all these crisis service settings available as well. So again, when you apply these different advanced views, these columns are going to change based on the view that you have applied. And again, you can export this information in an Excel format. So now let's take a look at our clinical summary. So for a clinical summary, it summarizes up to 5 years of treatment history for a client, and it sort of creates an integrated view from all databases available through PSYCKES. So we have hospitalization information coming from Medicaid billing, state PC residential services coming from state PC EMR. So we have all this information coming in from all these different databases, and we sort of summarize these treatment episodes to support rapid review. And in this clinical summary, you can also drill into each episode based on date of services, and I can show you how that looks like shortly. And because we have so many information being fed into the PSYCKES application, the way that our clinical summary is organized is sort of like an EMR, so it's easier to follow through, and we have dedicated sections of information. So let's see what sections are included in the clinical summary. So I'm not going to go through all of these, but here is a list of every single summary section that we have. So we have general section, notification sections, alert section, quality flag section, crisis services section, hospital ER sections. So here's a full list of different sections that you will find in the clinical summary. So taking a look at the clinical summary, so now that you have enabled access and you are able to drill into the clinical summary, it's divided into this brief overview and full summary. So what you are seeing right now is a brief overview. So this is sort of like a one-pager document that picks at critical information from the full summary view, and it allows for a quicker access to information, especially at around time where you may not have the time to review the full summary. The brief summary will provide those critical details. So as you can see, we have the general section here. We have the care coordination section. We often refer to this as who do you call section. And then we also have this notification section. So if a client is eligible for complex needs, it will tell you why they are eligible. We also have this Medicaid eligibility alert. So here it will notify that the client needs to recertify, whether through their local Department of Social Services or through New York State of Health, and it sort of provides a link on how to do that. And then we have this high mental health need or eligibility. So this is the first half of the brief clinical summary. So another thing that I wanted to mention is that we have this data source link located right at the top. And what this does is that we have all these information coming into the application. So it will tell you what the database is and what information comes from it, as well as how frequently that information is updated. So for example, for hospital and ER services, that is coming from New York State billing database, and it will also tell you that it is updated on a weekly basis. And as you can see, you can also export this in a PDF format. Taking a look at the brief clinical summary, as you scroll further down, you'll see this SDOH section. We also have this quality flag section, diagnoses past year information. So you can keep scrolling down. You'll find information related to medications, this outpatient provider past year information, and this is where the CCBHC service will show up. And then we also have this all hospital and crisis utilization section, and that's divided into ER visits and inpatient admissions, as well as crisis services. And as you can see, it will also tell you the as of date, and you can toggle over to view full summary or export overview. So you can export this brief summary as well. So let's toggle over to the full summary. And again, you'll see some of the information that you already have seen in the brief summary, but it will provide the details here as well. So we have the general section. So you'll see the client's name, date of birth, Medicaid ID. And then as you scroll further down, we have this current care coordination section. So taking a look at it as an example of our health home related information, you have the name of the health home, the date, the status, as well as a referral number and email, as well as the downstream care management agency that the client is enrolled in. So that is our current care coordination section, our who do you call section. As you can see, a lot of these also have the contact information as well. So another section that I wanted to mention is this alert section. So here you have all these different alerts that you can view in table and graph. And if you'd like to drill in further into specific dates of services or dates of these alerts, you can use this button right here to go into the drilled in view. And we also have the social determinants of health section. Again, if you see a hyperlink, it usually means that you can further drill into it. So for example, in this instance, we are going to select sheltered homelessness. So when you drill into it, it will show you date of service, service type, service subtype, provider name, as well as secondary, primary, and quality flag related diagnoses. And you can also export this in a PDF format or an Excel format. Again, we have our quality flags section. So these are all of the quality flags that the client is positive for. And you can also hover over these hyperlinks and find the definitions, or you can also select this definitions link and it will show you the definition. And you can also pull this information in a table format or a graph format. Coming down to our plans and documents section. So here you as a provider can upload a document and you can also fill in a new template. So for example, you can upload a safety plan, but you can also use the existing template that we have in the application to complete. So once you upload or if you create a new safety plan, it will sort of come up in the summary table. And then the same thing applies to our screenings and assessments. So you can take a look at the screening assessment name, the number of assessments entered, the date, the provider, assessments role, as well as the assessment result. And if you'd like to further drill into it, again, we have this drill in option located right here that allows you detailed information as well. And then we come down to our diagnosis section. So again, with all these blue hyperlinks, you can select any of these diagnoses to take a look at the drilled in view. So in this instance, we have the schizoaffective disorder selected. And here you can take a look at the date of service, the service type, the service subtype, provider name, as well as the primary, secondary, and quality flag related diagnoses. And again, you can export this in a PDF format or an Excel format. And then we can take a look at our integrated view of services over time. So here you can see all of these different services that a client has utilized, but in a visual form. And it really helps you sort of see the pattern here. So taking a look at the CCBHC service, as you can see, it seems like the client was consistent with the CCBHC service that they received, but now it looks like there is a gap right here. So they may have been not receiving CCBHC services during this time frame. So this is something that you can discuss with the client and take necessary steps if needed. So this is a visual representation, and you can also toggle over to the table format as well. And then here we have our outpatient behavioral health related information. And here, this is a new feature that we've added where we have expanded this procedure code. So usually in the past, we only had the most recent one. available. But now with this expanded view, you can see all these additional details for CCBHC, so all these additional procedure codes. And if you'd like to drill further in, you can sort of look at the information based on date of services and when the first visit was. And again, you can sort of upload this in a PDF format or an Excel format. And then here we have our outpatient medical services. Again, it's pretty similar to all the tables that you've seen previously. So we have service type, provider, the dates, the number of visits, recent primary diagnoses, as well as the recent procedure. And again, if you'd like to drill further into it and sort of divide it based on dates of services, you can select this drill in option. And then we also have our crisis services section. And again, it's a similar information that we have here. And again, you can further drill into it. And as you can see, it's sort of divided into separate rows based on date of service. And then again, we have our hospital/ER services. And again, you can further drill into it using this drill in option. And we have all these different service types: the provider, the admissions date, the discharge date, and all the relevant information that you may find helpful. And again, you can sort of toggle over to the graph section as well and find that information. So now let's switch gears into MyQI reports. So the MyQI report is a tool of managing quality improvement efforts. So when you log into PSYCKES, you will find two separate tabs for quality improvement measures and performance tracking measures. And again, the QI report is updated monthly, and within the report, we have the eligible population, which will be the denominator, and that is the clients that are served plus other parameters depending on quality indicator specifications. We will also display the number with QI flags, and that will be the numerator. I would like to make a note that each quality indicator measures have their own specifications and the way that they are calculated, and these sort of differ from flag to flag. So it's really important to refer to our technical specifications document, which can be found on our public website. So going back to our numerator specifications, these identify the clients who meet criteria for that specific flag. We will also compare prevalence rate for these provider agency, region, and state. So you can also filter the QI reports by program type, client residence or provider, location, region, or county. You also have the ability to drill into a list of recipients who meet the criteria for a flag. And we also have a race and ethnicity view of MyQI reports, which we will take a look at it shortly. And you can also export these in an Excel format or a PDF format. So how are clients linked to your agency's QI report? So clients are linked to a provider agency if they have been billed by the agency in the past 9 months. So we also pull information from the DOH MAP Health Home and Care Management Agency database. So clients that are linked to a provider agency, if they're enrolled in a health home or a CMA according to MAP, will also be linked to QI reports. And this rule is used to automatically link the clients to providers so that current clients are included in the report each month. So the period of observation for the quality indicators does depend on which measures you're looking at. So it will vary from each of these measures. So for example, we have the period of observation for the high utilization quality indicator at 13 months. So that is a 13-month look back period for that specific measure. So this is what our QI report looks like in PSYCKES, and as you can see, it's divided into quality improvement and performance tracking measures, which comes from DOH. And as you can see, the quality improvement measures are updated on a monthly basis, whereas for performance tracking measure, there is that 6-month billing lag. So let's take a look at our quality improvement measures. We have some of the CCBHC related filters that we have highlighted, so you can select these to further drill into a specific quality flag, and the further that you drill into, you'll be able to find more detailed information. So let's drill into this mental health performance tracking measures. We also have this SUD performance tracking measures, and that is available to view under performance tracking measures. So this is the DOH related measure. And again, it will also tell you that there is an intentional lag of 6+ months. So as you can see, we have all these different filters available as well. Another feature that we have is this filter option, and here you can actually filter by all these types. So in this example, we have this program type where we have CCBHC selected. So let's apply this filter and see what the numbers look like. So for Main Street Agency, we have applied the CCBHC filter, so all of these numbers are going to change. So we have all these different indicator sets, and you have the population, the eligible population. So that's going to be the denominator, and then the number with QI flag. So that's going to be the numerator, as well as these percentages. And when you're taking a look at these uh, chart, what you can view is that, if a high utilization, let's take an example of our high utilization. So if the indicator set is lower than the region or statewide prevalence rate in PSYCKES, the lower the prevalence rate, the better. So in this example, let's select high utilization and further drill into it. So when you further drill into it, it will show you these specific indicators. And the feature that we have available is that when you hover over these blue hyperlinks, it will show you the definitions. And again, we have a similar column sections that we previously saw. So you can take a look at these numbers and keep track of them as well. But if you'd like to further drill into it, you do have an option to do that as well. So when you keep drilling into these indicators, it will take you to this unduplicated recipients list where you can take a look at all the clients who are positive for this specific filter or specific indicator that you just applied. And again, if you'd like to drill into the clinical summary, you can enable access. But if this client has provided PSYCKES consent, you can enter that, and the client's name is going to appear in a blue hyperlink, and you can drill into it further. And you can export this in a PDF format or an Excel format as well. Another thing that I wanted to mention is that we also have this view section where you can either take a look at the standard view or the race and ethnicity view. So you can click on this eye icon, and it will show you this box, and it will tell you what these different views are and the columns that will be displayed when you select that option. So here we have our race and ethnicity view. So here, all of that information is going to sort of be divided into different race and ethnicity. And you also have this graph bar chart right here that provides a visual representation. So now that we sort of discussed what PSYCKES is, how do you go on about accessing PSYCKES itself? So if your agency does have access to PSYCKES, access is managed by your agency's security manager. So if you'd like information on who your security manager is at your agency, you can reach out to our PSYCKES help desk. So the security manager would go into the authorization management system and grant access to PSYCKES for the staff members. And if a staff member no longer requires PSYCKES access, PSYCKES access should be revoked, and that is also done by the security manager at your agency. But if a agency does not have access to PSYCKES, there are a few documents that are required before we can grant access to PSYCKES. So in that instance, you can reach out to our PSYCKES help desk, and we can provide you the documentations as well as resources. And once all of this is completed and access has been granted, the CEO has to sign the CNDA that will allow them access to the authorization management system. And here they can designate a security manager, and that security manager can also grant access to PSYCKES user as well as revoke access. But again, if you'd like detailed instructions on how to do that, please do not hesitate to reach out to our PSYCKES help desk. So this is what our PSYCKES homepage looks like. So you can log into PSYCKES using this button, but we also have this training materials section here where you can find many of our user guides. And then we also have our implementing PSYCKES section where you will find the documentations required to gain PSYCKES access, as well as consent forms and many other details. So this is a wealth of information that you have available, so please feel free to kind of go through them. And again, if you have any questions, please do not hesitate to reach out. So once you select that login to PSYCKES, you will select external and local provider. And here you will enter your username and passcode. So it can be a hard token or a soft token. So I know that we are at time, but I wanted to quickly ask for your feedback. So we may not be able to go through all of these questions, but I did wanted to show. So if there are any specific enhancement or any specific filters that you would like to see in PSYCKES application, please do not hesitate to reach out. So if you have a specific request for feature, we will take a look at your request and discuss it with the leadership. So if you have any requests, please do not hesitate to reach out. And for training and technical support, again, we have our PSYCKES help desk information here, but if you have token related questions, we recommend that you reach out to the OMH help desk. And I did wanted to mention that the slides and the recording link will be made available to you shortly after the webinar. So please feel free to refer to those as well. We can take a few questions and address them on air. Are there any questions that have come in?
Yes, Asma, we have two questions. So the first question is there a way to look at older data, meaning if I want to look at data from a certain period last year, is there a way to do that, or can I only see data as of the current date?
That is a great question. Thank you so much for writing in. So yes, you do have the ability to change look back periods. So when you log into PSYCKES and go through recipient search, many of those recipient cohort searches, those search buckets have this past 1 year or past 2 year option located on the right corner of the screen. So you can sort of switch the look back period through that option as well. So if you're looking for a specific section, please let us know through the PSYCKES help desk and we can sort of provide you a screenshot and where you can find them. But yes, you do have an option to look at data from past year or past 2 years. So hopefully that answered your question. But are there any other questions that have come in?
Um, just one more. So can we look up client data for clients who are being referred to us, but who we have not yet accepted for services?
Again, that is another great question. So in that instance, what you can do is that you can select attestation of services option when you're going through that enable access screen. However, when you select that option, it will link the client to your agency. So they will be included in your recipient search searches. They will be included in your QI reports numbers, but you will not be able to drill into their clinical summary. So in order to drill into their clinical summary information, you will need consent, but using attestation of services, you can link the client to your agency and have them sort of be part of that aggregate data. Um, so hopefully that answered your question. Any other questions that have come in?
Those were all the questions we have at this point. Thanks, Asma.
Thank you so much, Cameron. And once again, thank you all for joining today's webinar. We really hope that it was helpful. And if you have any questions about any of the application features, or if you'd like to provide us any feedback, please reach out to our PSYCKES help desk. And thank you so much. And I hope you all have a wonderful rest of your day.